Hi everyone, and welcome to this presentation, which is hosted by the Neurodevelopmental Assessment Service team. My name is Claire Morse, and I am a neurodevelopmental advanced practitioner, and I'm based here at the Pines Neurodevelopmental Centre in Inverness.
And I'm Sarah Gallagher. I'm also a neurodevelopmental advanced practitioner, and I'm also based here at the Pines.
So we've been asked to come here and chat to you today, and this presentation will also be recorded for the Pines website, and just give a little bit of information about what the Neurodevelopmental Assessment Service is, who's in our team, what we do, and also to give kind of a little bit of advice and maybe some reassurance to those of you who are on our waiting list for an assessment, whether you're a child or a young person yourself, or perhaps the parent or the teacher or somebody else associated with that child or young person. We're also hoping to kind of give a bit of advice about things that you might try or do while you're waiting to come and see us. So just bear with us a moment because we've got a presentation ready for you, which I'll just share just now.
When we start sharing the presentation, we think that we kind of we'll pop off to a little box at the side of the screen, and you might not be able to see both of us all the time. So sorry about that, but we'll try and pop in to view when we're talking.
Yes,
if that helps.
Yeah, a few technical glitches we had while we've been recording this presentation. But you will hear us, and you'll get to see the main content of what we're talking about here on the slides. So the first thing that we wanted to chat a little bit about is kind of what is NDAS and what we do. So NDAS, as I said before, it stands for Neurodevelopmental Assessment Service, and it's our job to kind of provide assessment and then sometimes diagnosis for children and young people who are living in Highland. And our main base is at the Pines Neurodevelopmental Centre in Inverness, but we cover all of Highlands, and Sarah and I are often on our travels, and so it's not always that families come down to see us. We sometimes go out to other places in Highland to visit them. So we'd like to chat to you a little bit about kind of who is in the NDAS team, so let's maybe do that first. And to start with ourselves, we are both neurodevelopmental advanced practitioners, or you might hear us being referred to as NDAPs. And this is actually a brand new role. So Sarah and I are both relatively new in post, and neurodevelopmental advanced practitioners have differing backgrounds. So for Sarah and I, we are both speech and language therapists by background, but we do have another NDAP in our team who has a disability nursing background. But essentially, NDAPs are professionals who have lots and lots of skills and experience in assessing for neurodevelopmental differences in children. And if you are coming to us for an assessment, the NDAP will be the person who kind of oversees the assessment, so kind of organises what type of appointments your child might need, and they're also kind of your contact person for the assessment. Is that probably? Yeah.
I think that's fair to say that that we recognised from the way that we were running NDAS previously. I worked in NDAS for a few years before coming to this job in the new service, and I think one of the things was that it wasn't always easy to get hold of somebody who was involved in your assessment or know who the person was that you should get in touch with. So that would certainly be now part of our role, is to be that sort of key contact person, the person that's going to be involved right from the start, right through your child or your young person's experience of NDAS.
So the NDAP will oftentimes actually be the first person who contacts you. That might be by phone or by letter, and the NDAP might also be the first person who you see as part of your NDAS assessment. But we also have a role for kind of overseeing assessments, maybe writing reports and feeding back to families and that type of thing. And and as we said, those roles are relatively new since we've been redesigning our service over the past year or so. So then the next professional on our list is the paediatrician, and the community paediatricians are still very much a part of our service, although their role has changed a little bit since we've had NDAPS come into post, and we've changed the way that we're working a little bit.
Mm-hmm.
So do you want to talk maybe about how things would have been previously?
Yeah, I mean, if anybody that's here or watching this has had experience of NDAS, like and I guess in the old system or the old way we used to work, the paediatricians were heavily involved in pretty much every appointment or every part of the assessment, and they would, it would often be a paediatrician alongside another identified professional. Very often that was a speech and language therapist, but could also be an OT or like another one of our nursing colleagues. But that has changed a bit now in that they are not involved in all of the parts of the assessment, but they're involved in, I guess, their kind of specific medical parts. And sometimes may come into other bits of the assessment too, if they, if that's appropriate and useful. But that's probably one of the biggest changes to the way that we're working now.
Yeah, so I suppose the take-home message there is that paediatricians are still very much valued members of the NDAS team, but if you are coming to NDAS for an assessment, you might not necessarily see a paediatrician first, or you might not necessarily see a paediatrician at all. So yeah, a paediatrician is somebody that you might meet if that's appropriate, but they won't be the person who's coordinating your whole assessment for you. That would be the NDAP. Yeah. Okay, next professional in our team is the clinical psychologist, and it's definitely clinical psychologist singular because we just have one clinical psychologist who is brand new in post. Actually.
Brand new, and it's new, I guess, to NDAS overall to have a clinical psychologist that's dedicated to the NDAS service. That wasn't something that we had previously, so we're really, really delighted that we have somebody permanently in post to be part of the NDAS team.
Yeah. And again, not every child and young person needs to see a clinical psychologist as part of their assessment process, but we do have a very, very busy clinical psychologist in our team to provide those assessments for us when needed. So next is our ADHD nursing team, and it's in the name. Those professionals are mostly involved with helping us with assessments for children and young people who might end up with a diagnosis of ADHD. Our ADHD nursing team are extremely busy because they also have lots of other jobs, including kind of like providing support.
Post-diagnostic,
exactly,
role as well.
So NDAS certainly isn't their only job, but we're very grateful to have them as part of our NDAS team doing assessments. So something that the ADHD nursing team might do, for example, would be to go out and do a school observation or something like that. Or you might come to an appointment with a neurodevelopmental advanced practitioner, and someone from the ADHD nursing team might be there as well.
A big part of their role as well is specialising in particular like questionnaires or special assessments that they might send out to you, and then you would send them back and they would score them up, and they're super trained, if you like, or super experienced with using those types of tools as well to gather information.
Yeah, definitely. Grateful to have their expertise. And then some other professionals who are a part of our team are occupational therapists, and we have a lovely occupational therapy team who are actually based at the Pines Neurodevelopmental Centre with us, so we know them very well. And I think they would be very much involved in assessments for things like developmental coordination disorder, which we'll talk about in a little bit more detail, and yeah, just wider assessments if we think that we need them. Again, the occupational therapy team don't only do neurodevelopmental assessments. They are very, very busy with lots of other jobs too, so we're grateful that they make time to help out with NDAS, as do the speech and language therapy team. Again, based in the Pines Neurodevelopmental Centre, so we know them quite well, and they would be involved in helping us to assess for any difficulties with things to do with communication. Next is our neurodevelopmental support practitioners. We have 2 neurodevelopmental support practitioners who, again, are very busy, and they help us out with all sorts of jobs to do with NDAS. I think recently they've been doing lots of school observations. So it might be that if your child is having an assessment in NDAS, a neurodevelopmental support practitioner might go out to the school and do an observation to see how they're getting on in class, to maybe chat with their teacher about whether there's any concerns with access to the curriculum or anything like that. But that's certainly not all they do.
No, they also do quite a lot of support around the time that you're thinking about making a referral to NDAS, or they can. So if it's something that you feel that you need support with, or you need that your setting or your school needs support with, then they can help you to sort of navigate some of the forms or the information gathering that we might ask you to do around that time. So they're super helpful around those things too.
Yeah.
And before we go on to the last bit, I thought also just to mention, we also have an assistant psychologist in the team at the moment who is doing some clinical work alongside our clinical psychologist. So that's another person that you may meet for some appointments, but you would probably have met the clinical psychologist first and then the assistant psychologist. But again, that's like a very useful person to have in our team.
Yep. And and then before we move on from the NDAS team, we just thought that we absolutely couldn't miss out our admin team, who we couldn't be without. So we have a lovely admin team who are based here at the Pines with us, who really do keep the service running. And if you've ever called the NDAS line to speak to our team, the ladies in admin will often be will usually be the first people that you chat to. So yes, very, very busy ladies, and very competent as well. So happy to have them with us. Okay, so that kind of summarizes who is in the NDAS team. So I think next we thought we would talk a little bit about the types of things that we assess for.
Yeah. So we've listed the main conditions that we would possibly give as diagnosis as part of the outcome from NDAS. And the wording that we've used on this slide is the medical terminology, the clinical terminology for these conditions that is in what we call the ICD-11. So it's the International Classification of Diseases Manual 11. And that is our clinical and diagnostic guideline for whether we have evidence to provide a certain diagnosis based on our assessment. So we have used that wording here. So the first one we've mentioned is fetal alcohol syndrome. You might also hear this referred to as fetal alcohol spectrum disorder, or FASD, or sometimes prenatal alcohol exposure. That kind of terminology might be used. These are all descriptive terms which are well recognised or becoming well recognised now. But the sort of official terminology is fetal alcohol syndrome. So that's a collection of behaviours and different brain strengths and pressures that we might see in a young person who has been prenatally exposed to alcohol. The next one is developmental language disorder. Now this one is probably slightly less well known at the moment, and we will often refer to it as DLD. It is a term that's been around for, we think probably, we were trying to think, between 5 to 10 years-ish. But before that, there was a different term that was used in the kind of speech and language therapy world called SLI, specific language impairment. And the terminology changed, I think, really to capture that DLD is under that neurodevelopmental umbrella. It's part of those neurodevelopmental conditions. And as such, we would assess for that within NDAS. And that will capture children and young people who have persistent difficulties with either understanding or using language. The next one is developmental coordination disorder, DCD, which you might know or have heard as dyspraxia, or like motor dyspraxia or motor coordination difficulty, something like that. And that term is used to describe children and young people who have persistent difficulties with motor planning and coordination. So for DLD, we would usually work or sometimes work alongside our colleagues in speech and language therapy. And for DCD, we would work alongside our colleagues in occupational therapy to make those specific diagnoses. The next one, autism spectrum disorder, it's probably the one that you might be, the most familiar with as a neurodevelopmental condition or difference. Probably, well recognized now, and certainly spoken about a lot in the media. We would assess for assess any child or young person who was presenting with the kinds of difficulties that we might see in autism spectrum conditions or disorder. And those are typically difficulties with social interaction and social communication, difficulties with flexibility of thought, some difficulties with understanding and relating to other people, and sometimes some sensory difficulties as well can come into that profile. So that's the autism spectrum disorder profile. And then the last one, attention deficit hyperactivity disorder, commonly known as ADHD, or ADD, or there's different descriptive terms also used, and that characterizes really the young people and children who struggle with mostly concentration, focus, hyperactivity and impulsivity. So those are the main conditions that we may or may not provide diagnosis for as part of NDAS. They're all neurodevelopmental disorders. That's what they're classified as in the ICD-11. And there may be other things that come up as we get to know a child or a young person, which we may decide to look into along the way, but aren't necessarily going to be part of that neurodevelopmental diagnosis, or wouldn't necessarily be initially thought of as something we would do within NDAS. And I guess the main one I'm thinking about is learning disability, or like intellectual disability, and that is not classed as a neurodevelopmental disorder. So we are not normally the kind of most appropriate service to assess for that condition. However, sometimes when we get to know children and young people, we identify that as possibly part of their profile. So we may at that point decide to investigate their cognitive skills, but it would always be in the context of a neurodevelopmental assessment.
Yeah.
So that's probably the main one, but there will be others.
Yeah.
That would come up
yeah,
the way.
And I think while we're discussing that, it's maybe useful to mention a couple of names of things that people might have heard of, which wouldn't be things that we would routinely assess for, because they're not neurodevelopmental conditions as such. So I suppose something which is probably worth mentioning is mental health conditions.
Yep.
And so that would be things like like anxiety-based symptoms or depression, and those things would be better placed to be assessed by our colleagues in CAMS, which is the Child and Adolescent Mental Health Service. I think that sometimes there's maybe a little bit of confusion about NDAS and CAMS and whether we're the same service, which we're not. We work very closely with our colleagues in CAMS, but we are two separate services. So yeah, mental health conditions would be something that would be more appropriate to be assessed within CAMS. Physical conditions, or kind of physical or medical difficulties would be better assessed by our colleagues in community paediatrics, again, who we work very closely with. And then I suppose the other one that probably comes up quite a lot is dyslexia. Yeah, dyslexia or any other kind of specific learning need, but dyslexia is probably the biggest one. There's some resources out there that might describe dyslexia as a neurodevelopmental condition and coming kind of under that umbrella, alongside maybe some other things that you may have heard of. However, it's something that we redirect to our colleagues in education who have the skills and the knowledge to assess specifically for dyslexia. It's not something that we would routinely look for. We don't have the skills and knowledge to do that as part of our assessment, and that's traditionally always been done within education. Yeah. Hopefully that's helpful. Just to run through what you might come across as some of the terminology that we use. Yep. Okay. Okay, so next I think we thought we would kind of just have a little bit of a chat about how we assess for these things, and if you do have an assessment within NDAS, what will that assessment really look like? And this is a bit of a tricky one, I suppose, because the assessment process will really be individualised for each child and young person, and that really means that assessment can look very different for different children and young people. And in terms of how long it takes to complete an assessment, that can really vary as well. Just depending on how much needs to be done. However, all assessments do kind of follow a similar structure. So the first thing that will happen is you will have an initial appointment. Now that initial appointment might be sent out to you by letter, and so we might ask you to kind of come and see us in the Pines, or in one of our other centres in Highland, or we might actually just phone you. But the first appointment will usually be around kind of gathering some general information about your concerns, about what's been going on with your child, or what's been going on with the young person who's been referred, and just finding out how things have been going and where the main concerns are. For some children and young people, the first appointment may also be done by a paediatrician. Now, the paediatrician appointment will be very similar. The paediatrician will invite you to come and see them, and they'll have a little bit of a chat with you about what the main concerns are. I suppose the difference is that they may also do more of a medical exam. Yeah, they will often want to do. There'll be certain medical things that they need to check and make sure that everybody is fit and healthy and doing well, and that may be part of that initial appointment if that's appropriate at the time. Yeah. So you'll have some kind of initial appointment, initial discussion, where you will have a chance to describe the current strengths and pressures and what you're really worried about. And we as the NDAPs will have a chance to get a really good history of what has life looked like for this child or young person, what's easy for them, what's difficult for them, what's their development been like up until this point. Now, based on that, we will then code for the subsequent appointments that they need, and we kind of refer to those appointments as being the assessment appointments. And that could be a whole host of things. So it might be that we will ask your child to come and see us in clinic, where we might do some kind of like standardized assessments or tests. I say tests, but these things are always administered kind of in a fun way, using using like books or different visuals for conversations or games or those types of things. But yeah, we might do a bit of kind of standardized assessment. We might also want to see the child or young person out in the community. So oftentimes that might be in school. So we might, or yeah, we or some of our colleagues might go out and and do an observation and gather information from other people who know the child or young person a lot better than us. It's also relatively routine for us to do appointments with parents and carers only, and that just lets us have a really kind of detailed and in-depth discussion about what's going on for that child or young person. It's also it's a chance for parents to maybe discuss in detail concerns that that it might not necessarily be appropriate to chat about lots in front of the child, and it just lets us gather lots of really detailed information.
And for lots of the young people that we meet in clinic, they would struggle to sit through that type of appointment anyway, because there's lots and lots of questions, there's lots of chatting. We might be asking parents and carers questions about when your little one was very little, which is a bit of a memory test for the parent or the carer. And we don't necessarily need to put the child or the young person through that appointment. So we will think about whether they need to be there or whether we can do that in a different way, to allow that sort of conversation to be a bit more relaxed.
Exactly. And what else? We might send out kind of different types of questionnaires, sometimes to parents, sometimes to teachers, so we can gather more information about what that child or young person is like in the community. Sometimes we ask young people to complete questionnaires about themselves, so we can gather some information about what they think about their own strengths and pressures.
If we can gather the young person's thoughts and feelings about their own brain profile, if you like, then we will certainly try to do that in a way that's appropriate for them and that they feel they can manage and that they want to contribute to. So there may be appointments based around that too.
And then once we've gathered all of that information, and sometimes it is a lot of information, the next step is something that we call formulation. So formulation really just means that we gather together all of the information that we've managed to collect, and we analyse it, and then alongside the other professionals that have been involved in the assessment, we formulate as to whether that young person meets the criteria for one of the diagnoses that we mentioned in the previous slide. And because these diagnoses are kind of described in a diagnostic manual, that means that there's very strict criteria that we need to adhere to in order for one of those diagnoses to be given. So usually we'll do that in kind of like a professionals meeting. So the people who have been involved in the assessment we'll kind of sit and look through all of the information, and we'll say, right, does this information meet the criteria for a diagnosis, or does it not meet the criteria for a diagnosis? And sometimes I think it's important to mention that sometimes, probably more often than you would think, it doesn't meet the criteria for a diagnosis. And that's not to say that the child or young person isn't experiencing difficulties in their day-to-day life. It's just to say that the pattern of their difficulties, or the way that their difficulties look as a whole, doesn't fit one of those diagnostic terms. But I think it's probably important to say at this point that if your child comes to us for an assessment and their assessment is completed and we decide that there's not a neurodevelopmental diagnosis to be had, we will still write a report kind of your child's or young person's strengths and needs, and give like a kind of almost like a brain profile, or a really good description of their strengths and needs, and any recommendations that we think would be helpful for them.
Yeah.
Do you think that's?
Yeah, and I think, you know, what we want to ensure is that regardless of the outcome of the assessment, so whether one diagnosis is given or more than one sometimes diagnosis is given or no diagnoses are given, that actually regardless, the going through the assessment process and the outcome at the end is still going to be helpful for the young person and for the family, because going through the assessment and gathering that information, and for us to have analysed that information and be able to feed back to you about that should still be the helpful bit, we hope, from you know, the outcome of that. So so that's what we're aiming for, is that the assessment process and the outcome, whatever the outcome is, are useful for you.
Exactly. So yes, even if a child or young person comes through our service and doesn't end up getting a diagnosis, what they will have is a really good description of themselves,
and they will have had a very thorough assessment as well. That, you know, that hopefully will have explored, you know, all of the areas that you've told us you're worried about.
Yeah.
Okay.
So off of the back of that, I think we wanted to do a little bit of myth busting, perhaps, and just chat about a few of the things that the NDAS doesn't do.
There's a lot of different kind of thoughts and opinions about NDAS and what we do here. So yeah, without kind of sounding too negative about what we don't do, I think it's really important to be clear about what we don't do. So NDAS is an assessment service only. Okay, so that means that our job is to assess a child or a young person's skills and their challenges too, and to basically report back on our findings of our assessment to you, the family, and to the young person themselves, and to professionals if that's agreed. So once we've completed our assessment, that is the child or young person's journey in NDAS completed, really. We will write a report at the end of that process, which will include our clinical impression, a diagnosis if that's been given, and some recommendations for ongoing places to access ongoing support. What we don't do at that point or at any point throughout the process is to provide any intervention. And we get lots of requests for children and young people who we can see quite clearly from the information that we're given, they do require support and intervention at the time that request is being made. And I think, there's maybe a common sort of misconception that NDAS is the place to come to access that intervention. But the truth is that there are other services, lots of other services out there that are much better placed to provide the support and the intervention at the time that you need it. So we will talk a little bit more about that later on. But one of the things that we really wanted to highlight at this point was just to say that coming to NDAS, being referred to NDAS, you know, going through assessment and or getting a diagnosis, none of those are required to access support and intervention at any time for your child. And that's something that we'll talk a lot more about shortly. But that's really, really important for everybody to know, is that we are not gatekeepers, and we don't make people come to us in order for you to access support and intervention at all. So hopefully that's reassuring, and we will give you more information about that quite shortly.
Yeah.
Is that okay?
Yeah. And I think that actually brings us nicely onto our next point, which is NDAS waiting times. Because I think I suspect most of the people who are watching this presentation are probably aware that NDAS unfortunately continues to experience long waiting times, and I think that's why we really wanted to highlight that point about NDAS not being necessary in order to access support. And as Sarah said, we'll get onto that in more detail shortly. But unfortunately, NDAS does continue to experience long waiting times, and we as the team apologise for this, and we certainly share your frustration about those waits. And we think that there's probably a number of things that have had an impact on our waiting times. And one of those things absolutely is COVID. So since COVID, we've seen roughly a 50% increase in the number of requests for assessment that we've received. And yeah, I think that could be, I think the way that COVID has impacted on our waiting times is probably multifactorial. The obvious one is that during COVID, services, did shut down for a period, and that created a considerable backlog, which is still impacting upon us today. I think it's also probably reasonable to mention that children and young people were impacted really significantly by the COVID lockdowns and all of those sorts of things. And for that reason, for children who kind of grew up in the pandemic, development may well look different for them. And I think that's an evolving picture, and we're still finding out. We have to wait to find out exactly how that's going to look. That's not something that we yet fully understand. But we suspect that might be contributing to the significant increase on the number of requests that we're having for assessment. So yeah, I think multifactorial, the reason that our waiting times are currently the length that they are, and at the moment they continue to be around 3 years from the point of the initial request. So yeah, just worth mentioning that our waiting times do continue to be quite considerable, and we're doing our very best to kind of sort that out and make those waiting times a little bit less. So I think that kind of brings us nicely onto the next section of what we'd like to talk about, and that is why wait for an assessment, particularly when it's it can be such a long and sometimes stressful wait. So next we'd like to touch on why waiting for an assessment is worth it.
Yeah, so as we said, we would hope that going through the assessment process, just in general, regardless of the outcome, will be helpful. And we'll talk. There's a few kind of reasons that we'd like to touch on that we think that it is usually for families and young people a helpful process. So the first one is around understanding myself. So thinking about from the perspective of the child or young person coming through assessment. Going through that process of assessment could help the child or the young person really to have that understanding about their own strengths and the areas that they find trickier. And the assessment can really help them to understand why those things might be trickier for them, or even just different for them, different to their peers, or if they're kind of aware that other people may not be struggling in the same way they are, and why that might be. Going through the process, we found, in our experience, that sometimes it can be quite an empowering process for that young person. It can provide them, I guess, with a sense of identity, realizing who they are, why their brain works the way it does, and about how their brain works. So really about kind of owning that information about yourself and recognizing it and using it to your advantage. For some people, young people who do receive a diagnosis, that can also provide, I guess, a sense of community. For a lot of people, they will find that they want to link with other children or young people who've been through the same process as them and possibly had the same outcome, and that can really help them to relate to other people who have had the same experiences as them. And when we're supporting a young person, we would normally always try to describe neurodevelopmental differences rather than deficits, and that's really how we would want to support a young person to feel that sense of empowerment and identity through the assessment process. So that can be one of the big advantages to coming through assessment, is that understanding of self and self-identity.
Yeah, and then I think kind of on a similar vein is our second little bubble here, which is other people understanding me. And in our experience for families, having an assessment in NDAS is something for the entire family. And I think for parents, it can often be empowering as well, because it can answer really long-standing questions about why their child's experiences might have been a little bit different to their peers, or why as a parent, why their parenting experience might have been different to what friends or neighbors or other people might have experienced,
or even other siblings.
Well. Absolutely. And assessment can also, at times can help to identify appropriate strategies and sources of information and that type of thing. And for education staff, the assessment process and the subsequent report, regardless of whether a diagnosis is given or not given, can sometimes be helpful for identifying additional strategies or things that perhaps they might not have thought of. Our colleagues in education are very creative in their supports for children and young people, but sometimes that can be helpful for professional colleagues too, is just to get more of an overall understanding of, okay, how does this child or young person's brain work, and what does that mean for what they need in their environment.
Then lastly, I mean, this isn't an exhaustive list of the benefits of coming for assessment, but like personally, I've worked with quite a lot of young people who've been around the time of transition out of high school or possibly going on to further education, and planning for their future has been something that's been very important to them. So for those young people who've come through the assessment process and therefore have a good understanding of what helps them, what their strengths are, also where their pressure areas are, it can be a lot easier for them to advocate for themselves. So going on to life after education, whether they're going on to a part-time job, a full-time job, an apprenticeship, or going on to further education, something like that, knowing what they need to support their own goals and achieve their potential can be really, really helpful in planning around that. So we feel we've seen, I guess, over the years in our experience that can be very, very important to families and to young people themselves, is that planning around their future as well.
Yeah.
So as we said, that's not an exhaustive list of all the reasons, but I think for us those are the main ones that we've felt have been relevant as we've got to know young people who've come through assessment and what they found helpful about it.
Yeah, absolutely.
Okay,
so hopefully we've convinced you that the NDAS assessment is worth the wait. Although the waits unfortunately do continue to be considerable. So I think that because of that, the next section that we wanted to talk about is who or what can help in this interim period. Let's say your child or young person that is on the waiting list for an assessment, and that waiting list, as we know, is likely to be around 3 years. What can kind of be done in the meantime to support that child or young person? So that's what we're hoping to cover in our Who Can Help section. And the first thing that we would like to mention is something called GIRFEC. So if there's anybody watching this presentation from education, GIRFEC will be extremely familiar to you. But if you're a parent or a carer of a child, then GIRFEC might not be so familiar to you. So GIRFEC stands for Getting It Right for Every Child, and it's Scotland's national framework for supporting children and young people. And you might also have heard of it being referred to as the Highlands practice model, which is kind of Highlands like adaptation of the GIRFEC framework. But essentially what GIRFEC does is it provides a framework for us as parents and professionals and the team around a child to identify any supports that a child might need and plan for those supports supports to take place. So if your child needs extra help, whether that's in school, in nursery, in the community, at home, the professionals who are close to your family can hold what's called a GIRFEC meeting and make a document which is called a child's plan. And the child's plan essentially is a document that, first of all, explains the child or young person's needs, and also kind of lays out a bit of an action plan about what should be done to help meet those needs and support that child or young person. Yeah. Really important to mention here that children and young people do not need a diagnosis in order to access support via the child's plan process. GIRFEC stands for Getting It Right for Every Child, and it's that framework should come into play anytime a child or young person is experiencing a difficulty that requires support, and whether there's a diagnosis associated with that difficulty or not, that framework is kind of available for everyone.
The other tool that sometimes you might see being used alongside the child's plan and the GIRFEC process, amongst lots of other things, is the ASN, or the Additional Support Needs Matrix. That's a really nice tool that education may use, not always, but they may use in order to identify which the class different levels of support that's needed for your child or young person. So you might have heard things like, oh, they're having level 1 support or level 3 or 4, whatever, and that really is to identify how much support is needed and where it's going to come from. So it can be a nice tool that kind of slots alongside the child's plan, alongside lots of other important input. But we just wanted to highlight that, as Claire said, it's really, really important to remember that there are no diagnostic or assessment barriers to accessing GIRFEC or the child's plan process.
Yeah. So the GIRFEC process is there, and if a child or young person needs it, then a child's plan should be created for them. The child's plan will lay out an action plan, which will have actions or supports that need to be carried out for them. Now, sometimes one of those actions might be to make a request for assessment within NDAS. And that, for some children and young people, that's totally appropriate to be one of the actions. However, if a child or young person is experiencing some difficulties that need support, it's really important that making a request to NDAS isn't the only action that takes place, because as we've already covered, NDAS is an assessment only service and won't be able to provide that child or young person with any intervention. So what we would also expect would be, within that child's plan, there should be additional actions that are supportive of the child. And that could be a whole host of things, but might be things like people in the child's environment making use of things like visual supports, or perhaps making sure that there's provision for small group time to be carried out in the classroom, or maybe it's as simple as adults adapting their own communication style in order to better support the young person, or even using specific tools like social stories and those types of things. And as I said before, many of our colleagues in education are super experienced in these types of things, and would probably have better ideas than us in deciding what sorts of strategies to try. And I suppose should definitely also mention our colleagues in educational psychology at this point. Who educational psychologists are closely associated with the schools, and often are able to kind of like do observations and make really good suggestions of things that can be in a child's plan, action plan, that people around that child should be trying.
And all of these things, it would also include sort of onward referrals to other services like, you know, speech and language therapy for, you know, for an intervention or support around communication, or OT, physio, you know, for similar. And these things, you know, can be done, I suppose, and hopefully actioned, you know, in a fairly timely way. Not always, but certainly, you know, some of these interventions that you could try, you know, they are things that hopefully can help now, or certainly in the kind of shorter term. And you know, as we've unfortunately mentioned already, it's unlikely we're going to get to your child or young person for much longer than that. So we would, you know, we would hope that there are things that can be done in the shorter term to benefit, you know, to benefit now and support the difficulties that you're having at this time. And then possibly things that might take a little bit longer for you to access. So it's really important, as Claire said, that NDAS is not the only outcome around, you know, around that child or young person at the time, which yeah, it probably very rarely is, but
No.
Because you know, we know our colleagues in education are very experienced at supporting where is needed, but that's what we would hope and expect to see from that process.
Yeah, probably. I think, yeah, I'm sure that we mention them again later in this presentation, but probably a good time to mention thriving families, who, I think, for those of you who are watching this presentation and are going to come to the Q&A, I think we will have representation from Thriving Families there. But they are an organisation who are actually based in the Pines as well with us, but they are able to give really good advice around accessing educational support and those types of things, and they've got loads of really good resources on their website. So I think if you want to find out more about the GIRFEC process and about child's plans and all of those types of things, then Thriving Families are probably good people to get in touch with.
There's a specific document about GIRFEC on their website, which is really nice and accessible. So yeah, I would highly recommend accessing them for support. Another organisation who are also, lucky us, based in the Pines, just around the corner, are the National Autistic Society, who I think also will be present at the Q&A that we're doing after this session. They also have lots of like online places you can access them. I think they have a website, but also Facebook and sort of groups that can be joined. And they'll be able to tell you a little bit more about what they do in the Q&A. We were also just going to mention a few other places to access support. So we've mentioned Thriving Families and the National Autistic Society already, who are based here in the Pines, and hopefully will be able to chat with us a little bit later. Sleep Scotland are a charity who, I think they're a charity. Yes, a charity, yeah. Who provide a service basically for families who are struggling with kind of any aspect of sleep for their child or young person. They have a helpline, which is really good. And they also have, well, I don't know how many at the moment, but we usually have some local practitioners in Highland that are part of their job is to provide support via Sleep Scotland. So they're a really great organisation to use. I'll talk about Just Ask just because I used to be part of my old job. So Just Ask is really great helpline. It's a telephone line that you can access on a Tuesday or a Thursday afternoon between 1 and 4. And if you call that helpline, you can speak to a range of professionals. I don't want to list them all because sometimes they're there one week and not the next, but generally you can access what we would call allied health professionals, so speech and language therapists, OTs, physios. You can also access the primary mental health workers, usually our autism practitioner. I think some of our education colleagues might sometimes be available, school nurses, that kind of thing. So it's great. You don't have to have your child already involved with these services. You can phone them and speak to them anonymously, and they're also like available for professionals too. So they're a really good resource that our are there and will always call you back. Even if they can't do it that day, they'll call you back soon, and you can talk through any concerns you have. And if they have any recommendations to make after that conversation, then they will sometimes make them at the time, and you'll get some advice. Yep. So that's super useful.
And then last one that we've mentioned here, and again, this is definitely not an exhaustive list, but is Enquire, which is Enquire is an impartial kind of advice and information service in Scotland for parents of children who have additional support needs, and it's particularly focused around accessing additional support for your child, and lots of the resources are kind of relating to like accessing support via education. So like you know, they have lots of useful things around, like, again, what is GIRFEC, what is a child's plan, how should I prepare for going to a child's plan meeting. So I think, you know, if you're a parent or a carer of a child who has kind of newly recognised additional support needs, Enquire can be a really useful place to go and just kind of find out, like what does all of this stuff mean, and what do I need to do, and who can I ask for further information. I think probably quite a big overlap with Thriving Families, actually, now I say it, and Thriving Families certainly are our local organisation, but both of those resources, great places to access kind of information around education, GIRFEC, child's plans, all of those types of things. I'm sure there's more.
There will be.
Yeah, but those were the ones that sprung to mind for us. And then kind of just to round off our section on who can help, we really wanted to identify that the last person, but definitely last but not least, person who can help the child or young person is you, and whether that is you as a parent, you as a professional, you as somebody else who is close to this child or young person. I think we want to really emphasize that the people who know the child the best are oftentimes the best placed people to kind of provide that support, because you know you're an expert in that child and their strengths and their difficulties and what they need. And you know, we really want to kind of empower you to know that there's lots of things that can be done while you're waiting for an assessment. I think, you know, hearing that a child or young person that you know has been referred for an assessment in NDAS, and then also finding out that there's a considerable waiting list, can really be, you know, that can be quite a stressful thing to happen. So I think what we're really hoping you kind of take away from this presentation today is that although there is a considerable wait for assessment, a lot of the kind of like supports that a child or young person might need can be put in place before that assessment process happens. And what we're hoping to do in NDAS is really just kind of enhance that process and enhance the information that's given to the child or young person and their family. So I think, you know, if you're a parent, please know that you're not alone. There's people that you can contact for help. You can phone the Just Ask helpline and speak to a whole host of professionals there. You know, you can maybe approach the people who support your child in education and ask them about holding a GIRFEC meeting or making a child's plan to kind of coordinate what needs to be done, or you can contact some of the other organisations that we've mentioned. You know, you can contact Thriving Families or the National Autistic Society. All of these people will be really happy to speak to you and to offer their advice and their guidance, whether your child has already gone through that diagnostic process or not. And then if you're a professional, you know, perhaps I think we'll probably have some teachers or people in education who are watching. We'd also like to let you know that, you know, if a child or young person that you know that's in your class or something like that has been referred to NDAS and is waiting, there's lots that you can do to support them now before that assessment process has taken place.
Please don't wait for us,
Mm-hmm.
because ultimately you probably already know and have the tools and information about that young person to put strategies into place.
Yeah.
And our part of it is quite a specific part of identifying diagnostically what there may be or may not be going on, but ultimately you know the young person really well. So yeah, please don't wait for us to put things into place. We wanted to highlight one particular resource that we think is really, really useful for teachers or any other professional to complete with a young person or about a young person. And that's the Neurodevelopmental Profile Wheel. Now, on the Pines website, we're not going to go into it in too much detail, because there's already a whole video and then subsequent other videos about how to complete the NDAS, the Neurodevelopmental Profile Wheel, and there's also documents that go alongside it for kind of guidance as well. But the overall kind of purpose of the wheel is to help you to identify the strengths and pressures for that child and young person, and therefore kind of make sense a little bit of their, starting, I guess, to make sense of their neurodevelopmental profile. And then in doing that, it can be really helpful to guide you around what might be some of the appropriate strategies to put into place to help that young person now, and not waiting until we get to them. That will be something we would highly recommend doing if you feel like you're in that situation where you don't know where to start or what kind of strategies or supports to put into place. The Neurodevelopmental Profile Wheel is a really, really good resource to use to help guide you.
Yeah. Yeah, and I think once you've completed the neurodevelopmental profile wheel, and as Sarah says, you have that better understanding of, okay, this person has got strengths in these areas, but their pressures definitely lie in these parts of the wheel. Let's say it was communication, for example. Then at your child's plan meeting or at your next kind of like parent-teacher meeting or at whatever platform, you can say, okay, we've done the neurodevelopmental profile wheel, we've identified some difficulties in this area, let's then direct our supports. And that's where your kind of child's plan action plan would come in. So a really good resource for kind of helping to make sense of a child or young person's needs if you're feeling like it's maybe a bit of a muddle. Yep.
Okay. So so that really brings us to the end. We've just gone over an hour, but that brings us to the end of this information session about waiting for an assessment. If you're watching this in the lead up to, or maybe right before the Q&A sessions, we'll see you soon in one of the Q&A sessions that we're running, and we look forward to answering some questions which have come up or routinely come up around NDAS, and we hope that's helpful. If you're watching this it's been recorded, or you're watching it at a later date, then thanks for watching and listening, and we hope that some of this information has been helpful for you in whatever situation you're in at the moment. Anything else you want to add?
Nope, I think that's it. Thanks for watching, everybody.
Thanks very much.